Another subject on psychiatric section. As you know, psychiatric disorders are used to be associated with some strange behavior. And some of the disorders that is associated with this strange behavior is trichotillomania or hair pulling disorder. Trichotillomania is also known as hair pulling disorder, which is a mental disorder that involves recurrent and irresistible urges to pull out hair from the body, from scalp, eyebrows, or other areas of your body despite trying to stop it. Hair pulling from the scalp often leaves patchy bald spots, which causes significant distress and can interfere with social and working functioning. People with trichotillomania may go to great lengths to disguise loss of hair. For some people, trichotillomania may be mild and generally manageable, but for others, compulsive urge to pull hair is overwhelming and embarrassing. Some treatment options have helped many people to reduce their hair pulling out and stop entirely. How about symptoms? Which symptoms do they have? So many people who have trichotillomania also pick their skin, bite their nails, or chew their lips, sometimes pulling hair from pets or dolls or from materials such as clothes or blankets may be a sign of trichotillomania. Most people with trichotillomania pull hair in private and generally try to hide the disorder from others, and this is embarrassing and creates some discomfort. So repeatedly pulling out hair, typically from scalp, eyebrows, and or eyelashes, increasing sense of tension before pulling and after pulling of hair, and feeling some relief after doing this. Noticeable hair loss, such as shortened hair or thinning or bald areas on the scalp or other areas of the body, including sparse or missing eyelashes or eyebrows. Preference for specific type of hair and rituals that accompany hair pulling or patterns of hair pulling, biting, chewing, or eating pulled out hair, and fulfill stomach with this one. Playing with pulled out hair or rubbing it across your lips or face, and repeatedly trying to stop pulling out hair or trying to do it less often but without success if not attended any type of the treatment. Significant distress or problems at work, school, or in any social situation related to pulling out of hair. Hair pulling can be of many types, like focused and automatic, where people pull their hair intentionally to relieve tension or distress, for example, pulling out hair to get relief from the overwhelming urge to pull hair. And it is like ritual and can be repeated many times. And another type is automatic, where some people pull their hair without even realizing they are doing it, such as when they are bored or when they are reading some books or watching a TV. So the same person may do both focused and automatic hair pulling, depending on the situations and mood, of course. Certain positions or rituals may trigger hair pulling, such as resting your head on your hand or brushing your hair. And to another times, like negative emotions or positive feelings. For many people with trichotillomania, hair pulling is a way of dealing with negative or and uncomfortable feelings such as stress, anxiety, and tension, boredom, loneliness, fatigue, or frustration. Remember that stress and anxiety are the most important factor in any of the psychiatric disorder and trigger this pronunciation of the symptoms. And positive feelings, where people with trichotillomania often find that pulling out hair feels satisfying and provides a measure of relief. As a result, they continue to pull their hair to maintain these positive feelings. Trichotillomania is a long-term chronic disorder without treatment symptoms can vary in severity over time. For example, the hormonal changes of menstruation can worsen symptoms in women. For some people, if not treated, symptoms can come and go for weeks, months, or years at a time. The cause of trichotillomania is unclear, but like many complex disorders, trichotillomania probably results from a combination of genetic and environmental factors. These factors tend to increase the risk, and they are family history, age, other disorders, psychiatric of course, and stress. Family history, like genetics, may play a role in the development of the disorder, and the disorder may occur in those who have close relatives with the disorder. Age usually develops just before or during the early teens, most often between the age 10 and 13, and it's often a lifelong problem. Infants also can be prone to hair pulling, but this is usually mild and goes away without any treatment. Other psychiatric disorders, as people who have trichotillomania may have also depression, anxiety, and OCD or obsessive compulsive disorder. Stress and anxiety are the main trigger factors, as I mentioned. Several stressful situations or events may trigger trichotillomania in some people. Also, far more women than men are treated for trichotillomania. This may be because women are more likely to seek medical advice and attention. Women have usually a long hair or just more hair. That's the cause they are trying to pull it out. In early childhood, boys and girls appear to be equally affected. Okay, now it's time for complication. Do you have any complication? Trichotillomania may seem particularly serious. They can have a major negative impact on the life. Complications may include emotional distress, problems with social and work functioning, skin hair damage, and hair balls. Many people report feeling of shame, humiliation, and embarrassment. They may experience low self-esteem, depression, anxiety, and alcohol or drug abuse. As existing an anxiety or depression from this overdoing of the process, hair pulling, anxiety and depression can have increased showing of the symptoms. Problems with social and functioning, work functioning. Embarrassment because of the hair loss may lead to avoid social activities and job opportunities. People with trichotillomania may wear wigs, style their hair to disguise bald patches. Some people may avoid intimacy for fear that their condition may be discovered. Skin and hair damage. Constant hair pulling can cause scarring on and other damage, including infections, skin infections on your scalp or the specific areas that you are doing this removing or pulling. Hair balls. Eating hair may lead to a large matted hair ball. Trichobezoar, called in your digestive tract, usually in stomach. Over a period of years, the hair ball can cause weight loss, vomiting, intestinal obstruction, and even death, because you cannot eat normally, and you have provoked vomiting from this discomfort of the stomach. And finally, the treatment. Research of treatment is limited. However, some treatment options have helped many people to reduce their hair pulling or stop entirely. Types of therapy that may be helpful include habit reversal training, cognitive therapy, acceptance and commitment therapy, and last line is coping and support. Habit reversal training. This behavioral therapy is primary treatment, and you learn how to recognize situations where you are likely to pull out hair, and how to substitute other behaviors instead. For example, you might clench your fist to help stop the urge or redirect your hand from your hair to your ear, for example. You'll not pull or scratch your ear. Other therapies may be along with habit reversal training. Cognitive behavioral therapy used for most of the psychiatric disorders. This therapy can help identify and examine distorted beliefs you may have in relation to hair pulling. Acceptance and commitment therapy. This therapy can help you learn to accept your hair pulling urges without acting on them. So you recognize that you have a urge you want to remove, but do not do this. And coping and support. Many people with trichotillomania report feeling alone in their experience of hair pulling. It may help to join a support group for people with the same disorder, trichotillomania, so that can meet others with similar experience and can relate feelings. And you talking with someone about this and make you less shameful. And treatment with medication. Antidepressants such as clomipramine, or known as anafranil. Other medications that research suggests may have some benefit include N-acetyl cysteine, an amino acid that influences neurotransmitters related to mood, and olanzapine, which is a typical antipsychotic, which is directed to stop these urges and crises. I also talk to your doctor about medications and be aware of any of the possible side effects, as many of them have side effects like dyskinesia, or tardive or acute, or some dystonias, or even a GI tract motility like have SSRIs and so on. Thank you very much for your attention. Hope this video is useful. If yes, you can subscribe and follow this channel. Have a great time.